This presentation was on breast cancer treatment. There are two types of treatments: localized treatments and systemic treatments. Localized treatments are surgery and radiation. There are two types of surgery: breast conserving breast con sorry breast conserving surgery and mastectomy. Breast conserving surgery only removes one part of the breast where the cancer cells are placed, and mastectomy is remove the entire breast. Radiation, there's two types of radiation: external beam radiation therapy and brachytherapy. External beam radiation therapy is outside, and brachytherapy is internal radiation. Internal radiation, where there is a device placed with a seed, with a radioactive seed into the breast. Systemic treatments, there are four types: chemotherapy, hormone therapy, and targeted drug therapy and immunotherapy. Okay. Chemotherapy is a drug treatment that uses okay. Chemotherapy is a drug treatment that uses anti-cancer drugs and administered orally or intravenously into the bloodstream to reach and kill cancer cells. Chemotherapy can be given before surgery or after surgery. These are the few drugs that are given. And when breast cancer is in its advanced stage, there are more intense drugs given. There are many major and minor side effects. The major side effects are menstrual changes, fertility issues, and the rest. Treatments for hormone receptor positive breast cancer. Some breast cancer cells are sensitive to hormone estrogen and progesterone. Breast cancer cells attaches to these hormone receptors, which enables them to grow. These hormones are naturally occurring in females. Therefore, the treatment used for these are sorry, hormone endocrine therapy. The hormone endocrine therapy targets hormones to inhibit its production, thereby blocking the growth of cancer cells. Hormone therapy is usually used after surgery to reduce the risk of developing cancer again. Hormone receptor positive cells are treated by either blocking the estrogen receptor or it slows it down. There are four ways in which you can this treatment is done. Selective estrogen receptor response modulators. These drugs are given where only the estrogen from in the breast cancer is blocked, but the estrogen in the ovaries is not. Aromatase inhibitors are given to women that are postmenopause, and estrogen receptor downregulators are given to those that mostly are post-menopause, because these drugs sorry these drugs cause also stops estrogen that's produced in ovaries. Treatments for ATR2 plus breast cancer. In certain breast cancer cells, the growth promoting protein ATR2 is found on the surface of the cell. These cancers grow rapidly and requires drugs to target this protein. There are 6 treatments for this breast cancer. Inhibitor, Herceptin, Cattleya, and Nalinx, Perjeta, and Tykerb. Each of these treatments tries to inhibit the production of the HER2 protein, thereby blocking the cancer cells from growing. Treatments for triple negative breast cancer. This does not have this does not have hormone receptive. It is neither hormone receptive positive or ATR positive, ATR2 positive. Chemotherapy is the main treatment. It's most common in women who have the BRCA1 and BRCA2 gene mutations in their genes. Their stage 1 to 3 in breast cancer surgery. You can either have um, breast breast conserving surgery or mastectomy. You have radiation, and after chemotherapy is given, and it's given after surgery to reduce the risk of cancer returning. Stage 4, for stage 4 of this, chemotherapy is used with drugs, with these drugs, and if you have the BRCA mutation, chemotherapy drugs called platinum drugs or PARP inhibitors are used. These for advanced immunotherapy, using immunotherapy to treat breast cancer, it is used in medicine to stimulate an immune response by recognizing and destroying cancer cells. The treatment is the PD-1 inhibitor, which is a protein on T cells, uses the drug pembrolizumab to target this protein. It is used with chemotherapy before surgery to treat the triple-negative breast cancer. The side effects of this, they are normal minor side effects, but the major side effects is infusion reactions, where you have allergic reactions, and autoimmune reactions, whereby your immune system starts to attack your body and other organs. Treatment by breast cancer stage. At stage 0, this is when the cancer is non-invasive. You still have to remove the cancer, so you undergo surgery, which is breast conserving surgery and mastectomy. And after that, you still have to undergo hormone therapy if you are hormone receptor positive. And if you are also ATR2 positive, you also need to undergo a targeted drug therapy. In stage 1, you undergo surgery first, then you have radiation, then you can either go, then you have systemic therapy, which is either the hormone receptive positive. If you are hormone receptive positive, you are treated with tamoxifen, or if you are post-menopause, you have aromatase you are treated with an aromatase inhibitor. Similarly, for ATR2 positive, you are treated with trastuzumab. Also, this can also be treated before surgery. Stage 2 is similar to stage 1, in the same order. However, if there are cancer cells found in the lymph node, then you are administered the drug abemacicillin along with the hormone receptor positive drug if the individual is hormone receptor positive. Stage 3 cancer. The cancer has spread into the lymph nodes. If the cancer is inflammatory, chemotherapy is done first. If ATR2 positive, if the individual is ATR2 positive, then it is given along with chemotherapy. But surgery, however, if there is not if the cancer cells are not broken down, if the cancers are not removed, then surgery can only be done by mastectomy. Radiation, if more chemotherapy is needed, then it is given before radiation with hormone therapy if the cancer is hormone receptor positive. Treatment for normal stage 3 breast cancer, if the patient is ATR2 positive, then these are the drugs prescribed. If the tumor shrinks, then the breast conserving surgery can be done. However, if it does not shrink, mastectomy cannot be performed. Radiation is done after surgery, or it could also be done before surgery. That's in stage 4. Sorry. If the individual is hormone receptor positive as well, then it is treated with hormone therapy drugs. In stage 4, this is when the cancer is metastatic. This means that it is invasive and all systemic treatments are mainly used for this stage. Localized treatments are only used when it's needed. That's the surgery and radiation. Hormone receptor positive cancer, um, tamoxifen or aromatase inhibitor are combined with a targeted drug such as the CDK4 to 6 inhibitor and the PI3K inhibitor. The tamoxifen is used for women who are pre-menopause, and the aromatase inhibitor is used for postmenopausal women. The ATR2 positive cancers, the drugs can be given concurrently with hormonal therapy, and the drugs are more intense compared to the other stages of cancer. ATR2 negative cancers in women with the BRCA gene mutation, chemotherapy with targeted drug PARP inhibitor, which is olaparib and talazoparib. Those are the drugs that are used along with chemotherapy. Triple negative breast cancer, the PD-1 protein immunotherapy drug combined with Abraxane is used.